Hi, Mrs. Smith. My name is Brent Louie. I'm a nurse at Nightingale, and I hear you're having some urinary retention problems. How are you feeling? I'm sorry you're feeling a little bit uncomfortable. Is it okay if I get your date of birth and your full name, please? And I see your wristband. All right, thank you. All right, so your doctor put an order in for a Foley catheter, so I'm going to be putting that in today, if that's okay. All right. I'm gonna close the door, pull the curtains, wash my hands, put on gloves. All right. So if you could lay down and then take off your undergarments, I'm gonna need to look your vaginal area. All right, and then could you put your knees to the side, pointing to the sides? Thank you. All right. So is it okay if I inspect your vagina? All right. So I don't see anything that'll interfere with the procedure. I'm gonna go clean your vagina real quick, okay? All right. So I'm gonna take a rag. I'm gonna be using non-wash soap. And then I'm going to clean the furthest peri area, front to back. I'm gonna flip this, non-wash soap. I'm gonna clean the peri area closest to me, front to back. I'm gonna flip this again, and then I'm gonna clean the meatus area, front to back. All right, the garbage can is right here. Toss that. All right, I'm gonna take another clean towel. All right, Mrs. Smith, I'm gonna blot the area dry now. So I'm gonna blot the meatus, or not the meatus, I'm gonna be blotting the peri area farthest from you, front to back. Flip it. I'm gonna blot the closest peri area to me, front to back. I'm gonna flip this again. I'm gonna blot dry the meatus, front to back. All right. All right, are you having any pain or discomfort right now? All right. So I'm going to take off my gloves. I'm gonna wash my hands. I'm gonna open my kit, one fold at a time. All right, so the outside inch of this is gonna be non-sterile, and the area inside is gonna be considered my sterile area. I'm gonna be taking the sterile gloves. With my non-dominant hand, I'm gonna grab the outer rim. Put it outside. All right. And with my dominant hand, I'm gonna put 2 fingers under. All right, I'm gonna toss the trash. All right, I'm gonna be putting a couple drapes over you and under you, okay? So is it okay if you lift your butt for me for a second? I'm gonna put this drape underneath you. All right. Okay. All right. And then I'm gonna be putting 1 drape over your vaginal area, okay? Normally this drape would be intact, but I use this for practice. So I'm gonna be putting the drape over the vaginal area so that the meatus and the peri areas are exposed. All right. Now I'm gonna be opening my alcohol swab stick so I have access to them. I'm gonna be opening my lubrication jelly and pouring it into the tray. All right. And I'm gonna be, all right. I'm gonna remove the covering to the catheter. I'm gonna throw the catheter covering away. And I'm going to be putting the front of the catheter in the lubrication jelly. While I do that, I'm gonna take my sterile water flush. I'm gonna take off the cap, and I'm gonna be putting it in here so I don't have to do that later. All right, Mrs. Smith, so I'm gonna clean your peri area and your meatus with some alcohol before we start the procedure. Is that okay? All right. So I'm going to expose the peri area and the meatus. I'm going to take 1 alcohol swab. I'm going to clean the furthest peri area, front to back. Toss it. I'm going to be taking another alcohol swab and clean the closest peri area to me front to back. I'm going to take the last swab and I'm going to clean the meatus area front to back. Okay. All right, Mrs. Smith. So I'm going to need you to take a deep breath and exhale slowly for me, okay? And when you exhale, I'm going to be putting in the catheter, the Foley catheter. I'm going to be holding the Foley catheter 2 to 3 inches away from the tip. All right, Mrs. Smith, are you ready? So breathe in, breathe out. While she's breathing out, I'm going to insert the catheter. All right, any pain? Good, I'm just going to advance this slowly until I start to see urine flowing. All right, I'm starting to see urine flow. So I'm going to push the catheter in another 2 inches. I'm going to take my non-dominant hand and hold the catheter 2 inches from the insertion point. And I'm going to start putting in the non-sterile flush in order to inflate the balloon. This is going to be 10 milliliters of fluid. All right, how are you feeling, Mrs. Smith? Okay, I'm glad to hear you're feeling okay. All right. All right, so once I push in all the fluid, I'm gonna slowly pull back until I feel resistance. All right, Mrs. Smith, is that feeling okay? All right, I'm gonna clean and dry the area now, okay? So I'm gonna take a clean towel and I'm gonna just clean the area, the peri area. So the outside peri area first, and then the inside peri area second. All right, now the sterile procedure is over, so I'm going to take the sterile dressing, or the sterile drape, and toss that. Toss the other sterile drape. All right, Mrs. Smith, so I'm just going to go over a couple things with you. So this is your catheter bag. I'm going to hang this bag over the side of the bed. When you move, make sure to keep this bag lower than you, and when it hangs, it's not going to be hanging on the rail, okay? It has to hang on another part of your bed, another non-moving part of your bed. So I'm going to hang that. I'm going to take this trash and toss it. All right, I'm going to remove my sterile gloves. Wash my hands. All right, and I'm going to I'm going to clamp this to her inner thigh. All right, Mrs. Smith, how's everything feeling? Are you in a comfortable position? All right, remember when you move, try not to pull on your catheter because that'll cause some discomfort. And if you do walk, make sure you call for assistance. Make sure you call for assistance, and you can use the call light. And make sure your catheter bag is hanging below you. Okay. All right. Thank you, Mrs. Smith. Hope you have a good day. Document.